All right, welcome. My name is Dustin Seaton. I'm the Gifted and Talented Specialist at the Northwest Arkansas Education Cooperative in Farmington. And we have two other guests with us today. I'll let them introduce themselves, starting with Mr. Chesser.
Hi, my name is William Chesser. I am the Science Department for the Fayetteville Virtual Academy in the Fayetteville Public School System.
Hi, I'm Dr. Bhakta. I'm the Vice President of Medical Affairs at Mercy and Rogers.
Yeah, and we thought we'd have a kind of an informal conversation today about mask usage, because right now we know the Arkansas Department of Education and in collaboration with the Arkansas Department of Health have highly recommended the use of masks for children and staff members coming for the start of the 2020-2021 school year. And we want to provide some tips and guidance as well as best practices for educators, things that they can do when school starts back. So with that said, I'm glad to have, we have a practitioner in the education field and a practitioner in infectious disease. Dr. Bhakta, could you tell us a little bit about why mask usage helps stop the spread of COVID-19?
Sure. There have been a lot of studies that have been done so far, even this year, that show that a significant portion of particles, or the particles that you emit when talking, coughing, sneezing, all those kind of things, just wearing a simple cloth mask actually decreases that significantly. There's been various numbers that have been attributed to that, various percentages, but in general, some studies even say if 80% of people wore a mask, we could maybe even eliminate COVID-19. So it's actually it's the best thing we can all do, along with washing our hands and social distancing, and wearing a mask is number one.
Can I ask a question about that?
Sure.
So I commonly tell people that unless you have an N95, wearing a mask is maybe more important for others than it is for the self. So for example, I don't have a bunch of N95s at my disposal. Those are the medical grade masks, is my understanding. So I've been wearing just t-shirt, a cloth mask, as you said. And I wanted to ask you, I have some thinking on why this is maybe effective, and I would love if you can tell me if I may be going down the right path here. You mentioned coughing, particulates leaving the mouth. And so I often think about, we're never going to get to 100% reduction, but we might settle for 90% reduction. That might be pretty good, right? If I could say, well, I can reduce your chance of getting this disease from 100% to 1 in 10, well, that's pretty good, right? So I wear a mask because even though I just use cut up old t-shirts. Even though I know it's not stopping 100% of particulates and maybe virions, which are the part that spread the disease, is my understanding, may not be reducing 100%. If I reduce that by, let's just say 50%, okay, of things leaving my mouth. And then another person I'm speaking to is wearing the same mask, and that might further reduce what they intake by 50%. Well, 50% of 50% is 25%. So we've now gone from 100% down to a quarter. We've taken it from 1 to 1 in 4. Am I thinking of that correctly?
Yes, you're absolutely thinking of that correctly. It's for the first part of what, yes, the cloth masks are made to protect others from you. The N95s are made to protect you from others.
Right.
The N95s, there's some tricks to that, to where it has to be properly fitted, and
right.
Your nasal bridge, it has to be snug, but usually that keeps out about 95% of particles, of virions. But with the cloth masks, the point is that we're protecting each other from ourselves, and our own virions, as you're saying. It's a considerate thing to do. It's the right thing to do. And it definitely, if everybody wears it, they're protecting everybody else from themselves. Everybody does it. You're right. Your calculations, it's the fundamental, it does decrease it just that much. I think 50% is a number just because everybody has different types of cloth masks. Yours might be t-shirt. Somebody else might have actually a cloth mask with a HEPA filter in it or that sort of thing.
Sure.
So there's all these different varieties, but I think 50% is a good number. So yeah, if you could decrease it down to 25%, that's very effective for decreasing the spread of this and how contagious it is. And the other part of the virus is that you don't have symptoms for a long time compared to other infections. And so even if you've been around it or, you're not going to get symptoms for 5 to 7 days. And in those 5 to 7 days, you may have been around quite a few people. The other thing is, some studies show 30 to 40% of people carry it, but they never even develop symptoms. So they can be active people that are infecting other people. They just don't and they don't get sick themselves. So they're what we call asymptomatic carriers. So it's just such a unique virus that we've never seen before. Anything like that just contributes to really being cognizant of mask usage. It just makes it even more important because it's unlike anything. It's unlike the flu. It's unlike anything we've ever seen. So it's just unique.
That point you just made is something I've brought up several times. I think it is very strange, and I'm going to say, and please tell me if I get this wrong, but my understanding is that what we call the presentation of the disease is the kinds of symptoms that the patient exhibits. So what it's like when you have the disease, right? And it might, have I got that right?
That's correct. That's correct.
So that we all recognize probably the presentation of a stomach flu, or what we call a stomach flu, right? It's that icky gastrointestinal throwing up, diarrhea. We recognize that presentation, even laymen. We might get wrong what's causing it, but we go like, oh, I don't want that. But I think, and tell me if I think you indicated this, but what's really, really weird about COVID is this really broad range of presentations going from really statistically significant, like very large numbers of people, like you said, 30 to 40% that may have no idea that they have this disease, all the way to, in the far other end, sometimes death, right? Extreme reactions. How unusual is that? That's weird, right?
Very weird. It's very weird. Some people that we've seen come to the hospital just have headaches, and that's their only presentation. And it's just a really bad headache. And they try to take Tylenol, Advil, whatever, just hasn't been effective. And they come in and they get tested and they're positive. And then kind of the symptoms, some of the other symptoms may be developed later, or they might not ever develop. So it is the array of symptoms that this virus is exhibiting is really weird. Some people just have a sore throat, and that's it. Fever is in fever is in a majority of the patients, but not all. Some patients don't have any fevers. So it's again very unique even in that way. It's not this typical just, okay, if you have these symptoms, you have this. It's just very different presentations for everybody. And then it affects people very differently. Some young people don't get sick at all. And then we just have some people that come in very sick that are young. So, the things that we do know is it does affect the older population and people that don't have a very good immune system. But the younger population that we see that are getting very sick from this, there's not a real common denominator. I think at some point we might see some sort of genetic component or something like that come through, but all of that is to be determined. In the meantime, I don't think that, none of us know when we get it, what it's going to present like or how sick we'll get from it. So that's also the risk that we take. And the other thing is even for young people, even if they get it, they don't feel bad. I mean, you would want to protect grandma, grandpa. You'd want to protect mom, dad. I mean, you just want to protect all those people from you. If you're sick, even if you don't feel so bad, they're not going to feel very good at all. And that's not nice. It's not a nice thing to do.
Yeah, I think it's funny to me because I think, I'm a guy, and sometimes guys are like, well, I'm tough, I can take this or whatever. And so they maybe don't wear a mask because they're like, well, I'm not gonna be scared. But I think the other thing about me is I'm also a father and I have a 10-year-old and I don't want him to get this. And I certainly don't want any of my students or coworkers to get this. And I feel like shifting that narrative, that's what I've been trying to do, is this idea like, I know, and I say, and I've been saying, I don't wear this mask for me. I wear it for you because it's totally possible I have this and I don't even know because I am tough. My immune system's great. I don't have any symptoms, whatever. But I might be getting other people sick and I don't want to do that because I care about the people around me. And I feel like that's an important message that maybe not be being shared as much, is that people don't understand, like, hey, you're doing this because you care about other people, not necessarily for yourself, but it ends up helping all of us, right?
I agree.
Grandma and grandpa, like you said, I have a father who's turning 87 this summer, and my mother unfortunately passed a couple of years ago. Well, the last thing I want to do is get this, have no idea I have it, and then go give it to my dad and cause him lots of problems. And I think that's the message we're trying to spread.
Sure. That you're spot on. And the other thing, kind of going back to the mask and sneezing, coughing, I mean, talking itself emits a certain number of viral particles with this. And so even talking, being around somebody and talking to them, there's a certain amount that you're producing anyway, that's airborne. And so unless you're going to go around somebody and not say a word and not breathe, you're not, it's just not gonna, you can't effectively say that you may not affect somebody else. So.
And I know in the classroom, one of the things we're going to combat day in, day out is the fact that there are N95 masks, cloth masks. I even went to my primary care last week and I was wearing a medical mask with a cloth mask over it, thinking I was doubling up. And he kind of looked at me funny. Is there best practices or recommendations as what would be best practices for wearing a mask for when school starts back and it's highly recommended?
Well, I think, the World Health Organization and the CDC just recommend a cloth mask at baseline. Anything above that is really a personal choice. If you want to do a medical mask and a cloth mask, that's okay. It's just not near as comfortable for long periods of time. An N95 is really not comfortable for a very long period of time, and it's really hard to breathe. So, especially if you're wearing it for 8 hours or however long a school day is, so I would really just recommend sticking with the CDC guidelines, and a regular cloth mask is fine. And an additional, if you want to do a medical mask with it, that's okay too. But really, just a cloth mask should be sufficient to achieve the whole point of wearing a mask.
And can we go back and define cloth mask real quick? That means literally could be a piece of clothing. Like, I don't have one down here, but I have a strip of t-shirt that I just tie around my entire face and nose. Is that acceptable?
That is acceptable. Per CDC, per WHO, that is acceptable. I think people have a variety of different cloth masks. My cloth mask has a little pocket in it where I could put a little HEPA filter if I want to. And some people feel better that way. I do. My personal choice is to have one of those with a little filter in it that I can take out and put back in and wash the mask. The other thing is when you wear your mask for the whole day, you probably want to throw it in the washer when you get home.
Yes.
And you don't want to keep wearing it every single day. You want to wash it frequently. But yeah, I mean, anything is better than nothing.
What about face shields? I know some teachers have talked about not wearing a mask, but just doing a face shield so that way kids can still, especially the younger elementary kids that are reading lips or learning consonant vowel sounds. Do you have any recommendation on best practices for what teachers can do that are wanting to wear face shields, or are there other devices out there that would allow for transparency of the lips?
So it would depend on how low the face shield goes to. I mean, if the face shield ends right here, you're still emitting particles. If it's too short, basically. If it's a longer face shield, I can see where that might be effective. Here in the hospital space, we use our face shields in our COVID unit, and Even when we're around patients, we're actually recommending some sort of eye protection too, but that's, here in the hospital healthcare setting, that's what we're doing. But I can see the utility of a face shield. If a teacher felt that they wanted to wear a face shield, I would just recommend that it's long enough, if you're not going to wear a mask, to where it's still effective in catching the particles that you're emitting when you speak.
Okay.
On that note too, sorry, I'm switching into physics mode right now. Those particles have to travel, right? And that has to do with the force that they exit with. But there's a certain distance after which, even if they're very small, they can't go, right? There's only so far they could go. Can you talk a little bit about how, as another sort of arrow in our quiver, another tool in our toolkit, just increasing the distance between people, how much does that help?
That's where that 6 feet comes from that you hear about, social distancing 6 feet. Some studies have shown that you can emit particles even farther than that, depending on the force of the sneeze or the force of the cough or that sort of thing. But 6 feet is deemed to be pretty adequate to be a good number, even for just regular talking. You can emit particles depending on how loud you're talking, how much force you're putting into it. And I would imagine, especially with teachers, when they are speaking loudly and trying to get things under control, and even in speech pathology where they're trying to enunciate things and that sort of thing, I would imagine that would be 6 feet would still be a good number to use for those particular situations.
So if you'll forgive me, I'm going to do a little math again, which is, let's say we're all wearing these masks, 50% for me, another 50% for you. And if that 6 feet reduces it even just another 50%, we're now from 1 in 4 down to 1 in 8, right? So we're radically, actually, I'm not even sure that's doing that math right. I think it's 1 over 50 times 1 over 51. Anyway, it's getting 1 over 2 times 1. Yeah, 1 over 8. We're getting down to 1/8, right? So if I can reduce my chance of transmission from 1 to 1/8, well, that's not 100%, but that's a pretty good reduction, right?
Yes, that's an excellent reduction.
Okay.
And then if you wash your hands, avoid touching your mask repetitively, continuously wash your hands. That's even another further reduction. So just taking those measures, that's really the most you can do. So you're right, the math does add up to where it just keeps going down the more you do these things.
And I guess some teachers have said that, and parents have said that they are fine wearing masks, but sometimes it sets up a false sense of security where they are more comfortable breaking that 6 feet barrier, or maybe not worrying about touching their mask or touching other parts of their face. Is it a whole package? I mean, is one strategy better than the other? If hand washing is more effective, or is mask wearing more effective in combating COVID-19?
I think it's really just a combination of all of it. But especially if you can't maintain that 6 feet distance, they really recommend wearing masks, to where everybody's universally wearing masks in that type of a setting. So some people,
especially in a classroom, for example.
Yes, I mean, if you can't put the desk or chairs 6 feet apart, then masks, in my opinion, should definitely be highly recommended in those settings.
Well, and some of the studies have talked about lately that some of the more intense cases have been because of the intensity and the density of the exposure to it, longer than 15 minutes, being in a confined area for longer than 15 minutes. Can you talk about the spread of COVID-19 based on the different environments? Because I think in the classroom, that's what teachers are most concerned about, is that we're going to be kind of in pods throughout the day if we're on site in August, that we're going to be together in a confined classroom for a long period of time. Are there best practices that we can do to encourage not just the 6 feet, but exposure, maybe going outside or getting fresh air? Or because not everybody will be wearing a mask if it's only highly recommended at this point by the Department of Health.
Well, I guess if the day is conducive to going outside, that being outside is a really good thing to do right now. In any social setting, if you're going to have that. Yes, even in our healthcare space, we've seen studies that show that if you're around it for greater than 10 minutes, you have an increased risk of of getting COVID-19. So we try to decrease the amount that people are in any given room for less than 10 minutes. More than that at any given time does increase the risk of getting it. And that's what studies have shown. So yeah, if it were me and I were a teacher, I'd probably be creative and find ways to get outside and keep doing those. You know, if everybody's not going to wear a mask, try to definitely keep the 6 feet spread. But then, I mean, if you could, I don't know what that looks like. I don't know anything about schools or teaching or classrooms, but if you could get up and midway through your class, go outside and come back in, I mean, anything that you could do to reduce it. Or I don't even know if you can have a class outside. I don't know what that looks like in your setting, but yeah, you could probably get pretty creative and decrease it, the chance of it even more.
One other quick tip I heard from a nurse when I went to my primary care last week is that she wore a mask all day, because you can take the mask off if you're by yourself, but she said she's hardly ever by herself. So she said one of the strategies she did was put a mint in her mouth just to kind of keep her mouth closed, and it helps with bad breath. Are there any other tips that you'd recommend teachers or kids to use, especially since in the hospital setting, doctors often wear masks all day long, nurses wear masks all day long in surgery, around patients? Are there any tips from the medical profession that you could provide teachers? Because this is the first time a lot of us have ever worn masks, ever.
Sure. I think that's actually a really good idea. Gum or mints or something that makes, because you're kind of smelling your own breath the whole day. And if you've eaten something kind of smelly for lunch, I'm sure that becomes irritating throughout the day. And I've heard some of my physicians say, you know, I really need another mask. My mask is now smelling from whatever they ate at lunch. So yeah, I would highly recommend a mint or something that really maybe, I mean, some people even put a little bit of lavender in there just to have a pleasant smell, you know, throughout the day, or, you know, anything that will make wearing a mask more comfortable for you, I would do.
All right. Thank you, Ms. Chester. Thank you, Dr. Bhakta, for your time today. We appreciate all your insight and tips. Hopefully we'll have a little bit more to look forward to in terms of what the start of school is going to look like in August. But thank y'all for now, and we appreciate your time.
Sure. Thank you.